Hi, my name is Tiffany Landsey, and today I'm going to be talking about femoral, arterial, and venous sheath removal. The purpose of a femoral sheath is for cardiac procedures like catheterizations, interventional procedures, balloon pumps. They can also be used in neurointerventional procedures like diagnostic angios. For this procedure, you're going to want to do patient and family education. It's important to make sure that the patient and family are aware that the femoral sheath needs removed as soon as it's not being utilized anymore. There was a study done by Kahn that 50% of patients that had prolonged femoral sheaths in place ended up having complications. Some of these complications can include infection or clotting of the sheath, which is something that we don't want, so these need to come out as soon as possible. It's also important to tell the patient that with removal of the sheath, the provider will be holding pressure at the site until hemostasis has occurred. This can cause discomfort for the patient because when doing it, for say, in a manual way, you're going to be putting almost your whole body, you will be putting your whole body weight into that site. So this can definitely cause some discomfort and maybe some anxiety for the patient. So you want to let them know about this. It also is important to let them know that sometimes it takes longer to hold pressure for some patients than in others, and this can be due to anticoagulation with the patient. Once the sheath is removed, we want to make sure that we stress to the patient that they need to stay on bed rest. This is extremely important because we don't want to cause a hematoma or rebleeding at the site. So the patient needs to be aware that they can keep their head at a maximum of 30 degrees, but they don't want to be lifting their head off the bed. They need to keep the extremity in which the sheath was in completely straight. And usually the bed rest hours depend on your institution. At my institution, we do anywhere from 4 to 6 hours, but I have seen as much as 8, just depending on what has happened. So it's important that we make sure the patient is aware of this. And I know that can be super difficult for some patients to stay still, and that is understandable. We also want to make sure that the patient is aware that they need to report any pain or numbness at the site, any changes with their extremities and sensation or motor skills, and that if they feel a warm or wet sensation that they let you know, because they could be bleeding again, and this means that pressure needs to be reapplied, and we need to make sure that the bleeding has stopped. Most importantly, at the end of providing education to your patient and family, you want to make sure that all questions are answered and that the patient definitely feels comfortable and is aware of what's going on. So for this procedure, there is quite a bit of equipment that you're going to use. You will want to make sure that your patient is on telemetry, cardiac monitoring, that they have blood pressure cuff going. These are all things that we want to get a baseline of their vital signs. You're going to want to have sterile and non-sterile gloves, protective eyewear because there is blood involved and you don't want to get that in your eyes. Any kind of antiseptic solution. My institution uses 2% chlorhexidine, so whatever your institution uses. You want dressing supplies, can also vary from institution, gauze, Tegaderm, dry sterile dressing, a pressure dressing, whatever you use. You want a 10 ml syringe to draw back blood from your port. You're going to have a suture removal kit if there are sutures in place, alcohol swabs, analgesic or sedation for the patient because this could help the patient feel more comfortable, and if that's something that they need, we definitely want to provide them with that. Also, some institutions use a hemostasis device. For this procedure, we're going to talk about doing it manually, so we won't be discussing that, but some have a pad or different types of solutions that they use. Also, you wouldn't have any emergency medications like IV, extra IV bolus bags, atropine, anything for if the patient were to have a complication like a vasovagal. Before doing this, we want to assess our patient. So you always want to make sure that you do your patient verifiers, you have the correct patient, and verify that with 2 verifiers. Then once you're in the chart, you want to look at their history. If they have any bleeding disorders, you want to look at their labs, their PT, PTT, INR, ACT, and platelets. Make sure those are all within normal range. You also want to look at their CBC to look at their blood counts. After that, we want to assess our patient. We want to get a baseline set of vitals. Sometimes these patients can be hypertensive, and if they are, they need treated before you remove the sheath because that could also cause a problem in getting the bleeding to stop. So we have our baseline vitals. We want to assess the site of the sheath so we know if anything changes. And then we also want to assess our extremity, our pulses, temperature, and color of our extremities so that once the sheath is removed, we have a baseline to compare to in case things were to change or if at baseline they weren't normal from the start. Then lastly, we want to make sure our patient has an IV because this is important for if we need to give any extra medications or anything like that. So to do this procedure, we're going to start with washing our hands and putting on our protective eyewear and our gloves. For first off, we're just going to use our regular gloves. We're going to make sure the patient is laying flat, and we will obtain our baseline set of vitals. After that, if the patient needs, we will give our analgesic or sedation. We then can set up our sterile area, which will include opening up our suture removal kit and putting that there. Hemostasis pad if we're using it, but in this situation, we're just going to talk about using manual. So any gauze or anything you might need for to clean up the area while holding compression. Then we want to make sure that with our non-sterile gloves, we go ahead and remove the dressing. Then we want to clean the site area with the chlorhexidine. After that, we want to ensure that there's no clot on our sheath by go ahead and grabbing our 10 cc syringe, hooking that up to the blood draw port, and taking a sample of 5 to 10 cc's. That will ensure us that there's no clot on the sheath. We then can go ahead and remove those gloves and wash our hands again, and we can place our sterile gloves on. Once we do this, we can take our suture removal kit and remove any sutures if they're there. We then want to find a femoral pulse, and once we find that femoral pulse, we're going to go ahead and for manual hemostasis, we're going to go 1 to 2 centimeters above the sheath position. And with our whole body, we're going to position ourselves straight above and hold down on that femoral artery with our body weight. While maintaining pressure and while the patient is exhaling, we're going to go ahead and pull that sheath out. We can hold pressure for up to 20 minutes to ensure that hemostasis has been achieved. And while doing this, since we're holding manual pressure, we're going to have somebody else come and assess the circulation and the pulses of the extremity where the sheath was. This will make sure that nothing has happened. According to Roltova, in 2019, she stated that if you have an arterial sheath and a venous sheath, you always want to remove the arterial sheath first. So in this case, we would remove our arterial sheath, then we could go ahead and remove our venous sheath. Once the venous sheath is removed, you want to make sure you hold pressure in both sites for a total of 10 minutes. Then make sure that hemostasis is achieved on both. After that, you can go ahead and apply your dressing, but before you apply your dressing, you want to palpate the site and make sure that there is no hematoma under the skin. We can now apply our dressing and our patient is good to go. Thanks for listening.